CDC report shows that U.S. teen girls are experiencing record levels of sadness and violence. Data released Monday shows that 3 in 5, or 57%, of teen girls felt sad or hopeless in 2021. That's 2 times more than teen boys, and the highest level reported over the past decade. The report also shows an increase in sexual violence and suicide risk among teen girls. For more on this, I am joined by the author of that report, Dr. Debra Houry. Doctor, thank you so much for being with us. Why are teen girls in particular vulnerable to these? In the findings, what makes teen girls particularly vulnerable?
So I think what I would say is that teen girls aren't vulnerable per se because violence is being perpetrated against them. So I think we need to look at holistically boys and girls as important to address both in these findings. And what I would say is when you look at something like sexual violence, if you're experiencing it, you are more likely to have mental health symptoms, use substances, feel disconnected. So we really need to address it all.
I guess what I meant was specifically with respect to the sense of sadness and hopelessness, distinct from the issue of sexual violence. Is there something that is happening that is making teen girls feel sadder and more hopeless than boys?
So what we've seen is just over time, this worsening. We saw issues with this pre-pandemic, and certainly it got worse during the pandemic. Some of this can be due to things like social isolation, but also things like social media, self-image, bullying at school. So there's no single reason for it, but many things we can do about it.
And did your findings show not just a difference in quantity of feelings, but in type or severity? The word hopelessness to me seems particularly powerful. Was it that you were not only finding more incidents, but that there was a deeper sense of feeling of hopelessness than you had found before?
So we didn't look at the deeper senses, but what we did also look at was suicide. And so we did see that there were increases in attempted suicide or wanting to make a suicide plan. So that is more severe, certainly, than solely feelings.
And what's your view about the difference between girls and boys in the findings?
So girls were more likely to feel suicidal and to attempt suicide. And our gay, bisexual, and questioning youth were also more likely to attempt suicide. Both really went up. And I think that's what's striking and devastating is, nearly 10% of girls attempted suicide and 20% of our gay, bisexual, and questioning youth attempted suicide. As a parent, I just can't even imagine. And these are things that we need to address now.
But I guess what I mean is we know how they differed, girls and boys, but is there any reason or any preliminary thinking about why they were different, the difference between girls and boys in the findings?
So I think, drawing from what you raised about the hopelessness, sadness, also we saw that boys were more likely to feel connected to school. So I think where you've got some of the social supports in place, like connectedness, and then on the flip side, if you have more mental health symptoms and you're experiencing trauma, you're more likely then to attempt suicide.
And Doctor, you mentioned how just gut-wrenching these numbers would be to parents, particularly. Let's start with parents. What and how, knowing these new data, can parents do to recognize the signs, to begin the conversation when those of us who've been parents of teenagers know that that's sometimes very difficult to do?
So I think to be as open and non-judgmental as possible so that your child is comfortable coming to you and also looking for signs. Are there changes in appetite or sleep apart from the usual teenage changes? Are there trends in this? It's also important not just to talk to your child, but also to know their friends and their friends' parents. That way you're able to have an open communication with families around you, build that support system, and have a good sense of where your child is and what they're up to.
And now, what about schools? What can schools do to play their part in handling this challenge?
Schools are so important as a part of the solution. Things like teaching life skills, conflict management, what healthy relationships are, as well as overall health education as well is really important. And certainly connecting students to health and mental health care.
And finally, Doctor, if I'm a young person and feeling this way, and I don't want to talk to my parents about this, who do I go to?
Tell a peer, tell a school counselor, or call 988. We have the suicide prevention hotline that is available 24/7.
Dr. Debra Houry, thank you so much for being with us.
My pleasure. Thank you.
If you know someone who needs help, the National Suicide Prevention Lifeline Network is available 24 hours a day, 7 days a week. You can call, text, or chat their hotline using the 3-digit number 988. That's 988.